Since we're all here, should we get cracking? And then we can cover more? Excellent. Good. So, session 2 is about brain allergies, ADHD, and autism. And the critical thing here, as you know, with your clients, can you gain weight in hours? I had one person who lost 5 kilos in 3 days just by avoiding food intolerances. Do you get bloated after eating? Do you suffer from irritable bowel syndrome? Do you get sleepy after eating? Do you get brain fog? Do you suffer from hay fever, rashes, itches, asthma, shortness of breath, unexplained headaches, intermittent aches and pains? Do you get better on holidays abroad when your diet is different? So we're very interested in someone who one day their knuckles are hurting, next day they're not. One day their mind is clear, next time they're foggy. One day they get a headache, next day they don't. Symptoms that come and go could be to do with an underlying food intolerance. This is your gut, the villi. If you lay the surface area out flat, it's the size of about twice this room. And in between those folds are billions of bacteria. We have more bacteria than living cells, the probiotics. And we will produce about 8 liters of digestive juices a day, which break the large food particles down into small particles, which then have to be absorbed into the bloodstream. So very often, for example, with irritable bowel syndrome, which is really a combination of, bloating, abdominal pain, irregular bowel movements, sometimes diarrhea, and lack of energy and so on. And there's all these FODMAP diets, et cetera, which are difficult. And they work for some and not for others, and so on. My first step with any digestive problem is to give a digestive enzyme supplement. It's relatively inexpensive, not only containing the obvious things like lactase for milk, protease, lipase, but also glucoamylase for greens and galactosidase for beans. Some people do not make enough of the enzymes to digest greens or beans. And the point is that if you've got somebody with such, digestive-related problems, you give them a digestive enzyme. If it goes away, then you know they're not making. It's not an allergy. It's a lack of sufficient enzymes. So it's both the test and the cure, and that should be done first, I think, with anybody with digestive problems. And then we could have a whole seminar, but I'm not going to do that, on probiotics and the microbiome and all that. And as nutritionists, that the 2 families that are most resident in the gut is the Bacillus family, Lactobacillus, Acidophilus, the primary one, and the Bifidobacteria. When we eat yogurt and fermented foods, which make lactic acid, which is very good, and our lovely Streptococcus, Thermophilus, and so on, these are not resident. So they're not bad, they're good for you, but they're not resident. These are the resident strains. And then we have bad ones here, like, Staphylococci and all that stuff. Interesting, I'll tell you one story here, not on the mental health thing, but I've been converting these ancient barns in Wales, and very dirty and very hard work, and probably quite, exhausted at some point. And I started to get these boils. And boils is usually a staphylococci infection, Staphylococcus aureus, or SA. So you've heard of MRSA, methicillin-resistant Staphylococcus aureus, so resistant to the antibiotic that you would take for it. Anyway, this happened, and they gave me some antibiotic. It was a nasty strain. It wasn't MRSA, and it didn't work. And I got another boil, another course of antibiotics. It didn't work. And then I remembered a study a few years ago that gave niacin, vitamin B3, to animals infected with MRSA, and also infected cells with MRSA, high-dose niacin, 1,000 milligram equivalent. Fantastic. So I Googled it, and I found a guy who had, he was on his 15th course of antibiotics for MRSA, which wasn't working, and he took high-dose niacin and went.
Nicotinic acid?
I don't think it matters. Niacinamide is fine too. And so I did it, and I went. So there is a role not yet proven, this is one very nice study, but it hasn't turned into clinical trials, but high-dose niacin has an antibacterial effect. Interesting. Anyway, I thought I would tell you that. So when the gut becomes damaged, and by the way, what is the biggest cause of gut damage? What do you think it is? Antibiotics. Antibiotics do damage the gut. It's not the biggest common cause. What? Stress? Wheat? Alcohol? No, it's actually non-steroidal anti-inflammatory painkiller drugs, right? Like aspirin, ibuprofen. So, yeah. So in the UK, the average person takes 373 a year, and most people, when they take them, are taking 6 a day. So you're right. Too much gluten, stress, antibiotics, but also. And this is sort of quite serious. I was on my island in Kenya where I go, Lamu, and the man who runs the yoga center, he said, I've got a young man, a guest, an Englishman, 25-year-old, and he's bleeding from his backside. Is this dangerous? I said, yes, it's very dangerous. We need a plane quickly. And we went out and put some torches on the beach and arranged a plane that came and landed on the beach and picked him up, took him to Nairobi Hospital. And if he had arrived 1 hour later, he would be dead. And he had quite a stressful job in the stock market. He'd come on holiday. So he was actually taking antacids because he had some stomach trouble. And he drank a bit too much. We all do this on holiday. And so he had a hangover. So he's taking the NSAIDs. And the combination, he clearly had a bit of an ulcer, he didn't know. Combination caused internal bleeding. We have 3,000 people in Britain die every year from this. So when the gut is more permeable, things get through that should not. So you need a good diet, avoid what you are intolerant to, pathogens, like I just mentioned, one, good diet, digestive enzymes, probiotics, and glutamine. Glutamine heals the gut very quickly. The gut cells feed on glutamine. And check for and remove allergens. So the link between allergens, or if you like, food intolerances and mental health has been known for a very long time. The first study was by Dr. Egger in 1980. 30 patients suffering from anxiety, depression, confusion, difficulty concentrating were tested using a double-blind placebo-controlled trial. And the results showed that their food intolerance or allergies alone, not placebos, could produce severe depression, nervousness, feeling of anger without a particular object, loss of motivation, and severe mental blankness. One of my first patients I treated in 1981 was called Liz, and she was schizophrenic. And she was like 20, 21. She was diagnosed age 15, dropped out of school, no friends, gained weight, depressed, schizophrenic, heavy-duty medication, and it turned out that she was gluten intolerant. And once removed from gluten, she was no longer schizophrenic. And 3 years later, I rang her up and said, how are you? How have you been? And she said, very well, thank you. By the way, she went on and got a degree and got married, had kids, you know, super woman. And she said, I went to a party, I went crazy for 3 days. I said, how come? She said, I ate a salad. And the salad had a dressing on it. And the dressing had starch. So she was hypersensitive to that. So this is the area of brain allergy. You can eat a food that can trigger a symptom. I think you will know that the conventional food allergy, so-called quoted, is IgE-based. And what I think we, for more political reasons, called a food intolerance is IgG-based. But they're both immunological reactions against a food. So really, it is an allergy. That's the definition. But the IgG antibody reaction does not happen so fast and so severely. I mean, the worst case I know is a lady who was shellfish allergic in a restaurant, and the table next door ordered a plate of shellfish, which came, and she inhaled the fumes, had an anaphylactic reaction, and died. Right? That's IgE. It's not IgG. IgG, you can eat something one day and you don't know, because the next day you react, and it's not so easy to find out. So the link between wheat and milk has been, again, known for quite a long time. Celiac disease, which is the most serious, and it's not actually IgG or IgE, it's IgG-ATT. It's a different kind of antibody that the body produces. Affects 1 in 30 people with depression or digestive disorders. It's often the first manifesting symptom of celiacs is depression. Most people a third take up to 10 years to be diagnosed. IgG antibodies to both gluten and casein are much more common in people diagnosed with psychiatric disorders, including bipolar, schizophrenia, and autism. Having these intolerances is strongly linked to inflammation in both the gut and the brain. Eric was reminding me yesterday of the pioneering work of Carl Reichelt from Norway, Lab 1, who had reported great results with children with the autistic spectrum disorder, putting them onto a gluten-free and casein-free diet with improvements in social isolation, eye contact, mutism, hygiene, learning skills, hyperactivity, stereotypal activity, self-mutilation, and panic attacks. So again, this is not something like autistic spectrum disorder. It's not caused by one thing. There are many factors going on, and not everyone responds well to a gluten and dairy-free diet, but it's not a bad thing to experiment with. We have some kids that we are treating. One is very, very gluten and dairy sensitive, non-verbal, but will only eat pizza. Only eat pizza. So the mother has learned how to make a gluten-free, dairy-free pizza, which they put in the pizza box, pass out the window, and then the husband comes in the front door with the pizza, and the kid will eat it, and he's improving very well. We have others who are allergic to and addicted to milk, and every day you just reduce the amount of milk with a bit of soya milk or almond milk, but just slowly dilute it. Do this over a couple of weeks and gradually fade away the milk and bring in the other one. So some of these kids if you're addicted to a food, you have to have that food. It can mean that you are intolerant. I don't know which lab you use, but in the UK we have a lab called York Test who do it well. And, you buy the kit, you prick the finger, you start to bleed. They have a little absorbent wand that you put against the blood spot, and when the whole thing is red, you pop it in the tube, you send it back to the lab. And this is tiny, but they spin the blood because it's the clear part where you have the antibodies. And each of these trays are preloaded with a food protein. So if you've got the antibodies in your blood, it will react with the food protein. So that is a reaction. That is a strong reaction. That's a tiny reaction, and all of these are no reaction. And the problem that we have is that there are quite a few IgG labs, and they are using different setups. So there's no calibration. Unlike, you have your glucose tested, it's the same everywhere as a standard. There is no standard for IgG testing. So this is why you find variation between the laboratories. But I would say, honestly, if you're exploring the area of food intolerance with a client, why not start with as much information as you can? So this isn't necessarily a proof, but, if the immune system is reacting against these foods, then that's a very good place to start. So, this person is reacting to cow's milk, egg yolk, egg white, and gliadin in wheat, but not so strongly, to wheat itself. So it's the gliadin in the wheat that they're reacting to. So it's a useful test. And generally speaking, in surveys of 5,000 people who did this test, 3/4 notice an improvement within weeks. So, it's not a perfect science, but it's a very useful, it's one of the tests that I use the most. So we have a lot of clients, and I can't believe how much better I feel. 500% better when I started 3.5 months ago. I had suffered depression for several years. I didn't want to go on antidepressants for the fear of addiction. And since being on the supplement program, cutting out the foods I'm intolerant to, the depression has lifted, I'm no longer anxious, and the dizziness has gone. I'm sleeping much better. My digestive problems have cleared as long as I don't eat something I'm intolerant to. So this is a very useful area. Moving on to children, these are the kind of symptoms that children would get classified as hyperactive or attention deficit disorder. One of the first areas I worked in, probably my first campaign, was on getting lead out of petrol. And if you don't know this, I think back in the late 70s, there was a Professor Needleman, Herbert Needleman, who collected baby teeth from a school of, I think quite a lot, like 1,000 children. And he created a scale of symptoms like this. This is before ADHD or hyperactivity existed as a diagnosis. And he measured the lead level in the baby teeth and was able to show the higher the lead, the more the hyperactivity. And that was one of the very first studies that made us become aware of the dangers of lead in petrol, which ultimately led to the banning of lead in petrol. And I remember in the early 80s being on a beach in Greece. Okay. Anyway, I was on a beach in Vasiliki in Greece, and the man on the towel next to me was the headmaster of a special educational needs school for severely handicapped children. And I said to him, send me a dozen hair samples, and I will tell you how the children behave, which he did. And 9 were fine, and there were 3 that were strange. 1 very high lead, and 2 were high copper. And I said, this one with a high lead will be aggressive, impulsive, unable to control, and very poor attention span. And it was the worst child they'd ever had. This child had had so much psychotherapy, they tried on medication. Eventually, they gave the child electroconvulsive shock therapy, and he was loaded with lead. And the other 2 were high in copper. And I said, these will be more paranoid and anxious, because copper actually hypes you up in that way. If you have too much, you have to have the right balance, copper and zinc. It turned out to be a school teacher and his wife. And the wife had developed anxiety and was being prescribed tranquilizers. And it turned out that they had, a year or so before, built a house on the school grounds in an area where the water is soft, more acidic. And when you have a new house with a lot of copper pipes, and if the water is soft, you get more copper into the water. After a few years, especially if the water is hard, it gets calcified. It's not so much of a problem. But she was getting copper overloaded from the water. The husband didn't seem so affected, but she was. So one of the big problems is we're labeling children with one thing, when actually every child is overlapping disorders. Maybe some dyslexia, where they have problems writing or seeing the words and how they work. And some have dyspraxia, where you're clumsy, you know. And for example, we would ask a child to throw a ball, clap, and catch. If you have dyspraxia, you can't do this. Some are hyperactive, some cannot concentrate. And so even the label really is wrong. We're not so interested in the label, we're interested in what's going on underneath. Is there a blood sugar problem, a food intolerance, blood sugar problem, a lack of omegas? Magnesium is important, zinc is important, B vitamins, food insensitivity, homocysteine, which I'm going to talk about a lot in some detail. So this is how we would approach those kind of problems. So I was called in by the BBC to one state school, primary school, and they said, can you change your child's behavior and learning in a week? And I said, probably. I've done all these TV challenges, and they've always worked, which shows the power of nutrition. So I went into this class of 30 children, age sort of 6, 7, And I said to the teacher, how many of these kids are having problems sitting still, paying attention, concentrating, learning, reading, writing? And she said 10. So this is quite normal. 1/3 of children in the average class are struggling in some way. And I said, who's the worst? And she said, Reese. So what I did was I got all the parents together and said, for 1 week only, 0 sugar. I want you to give your child some fish, at least 3 times in this week. And I'm going to give you a drink that has extra vitamins and minerals for them to have. And put some nuts or seeds on the cereal in the morning. So add some basic diet changes and vitamins and minerals, not essential fats given as such. And I asked the teacher on the day before we started this mini trial to give an assignment where they would have to write a story. And this was Reese trying to write a story. Okay. 1 week later, this is Reese. Right. He went up a year in his reading and writing ability in 1 month. Same child, 1 week later. Happy chappy. So when I first started to study nutrition, I looked at a study that showed more vitamin C, higher IQ. The lower your lead, the higher your IQ. This was a survey which showed that the children with the highest sugar had 25% lower IQ. I remember writing an article for the Daily Mirror in England called Sugar Makes You Stupid. And I have had the Sugar Bureau on my back ever since. So then this was our trial doing multivitamin with a 7% change in IQ. So I showed you this earlier. But one thing I want to say here, while it is absolutely true that the worst nourished children get a bigger response, this is a study on well-nourished children and marginally nourished, but even among the well-nourished children, the micronutrient intake resulted in improved verbal learning and memory. In this particular study, they're giving quite low levels of DHA, EPA. There was no effect on the cognition from the essential fats. Broadly speaking, I would say that the essential fats improve mood, so they make a child calmer. As a consequence, they may be able to concentrate and engage a bit more, but they don't seem to improve IQ. It's more the vitamins and minerals that improve IQ. And if you were to say, what is it in the vitamins and minerals? Because when we did our study, we were giving B vitamins and zinc and magnesium and so on. It's probably mainly, I would say, methylation nutrients, B vitamins, but I'll come on to that. Here is a boy who had zinc deficiency. So these pictures are taken every month. So he went from here to here, to here, to here, to here. From there to there in 5 months, given zinc. Nothing grows without zinc. You get the white marks. I must take a better picture, but you get the white marks in the nails. If you have a lot of white marks in the nails, it's a sign of zinc deficiency. And interestingly, with this COVID thing, one of the signs of zinc deficiency is loss of sense of taste or smell. So whether that is in COVID a function of depletion of zinc, it's entirely possible. And I think you know that the malaria drug, hydroxychloroquine, is a zinc ionophore. It drives zinc inside cells, and zinc is very antiviral if you can get it inside cells. And this SARS-CoV-2 virus inhibits zinc getting into cells, so you need a carrier. Quercetin is also a carrier, but less toxic than hydroxychloroquine. Hydroxychloroquine is quite a dirty drug. And it's part of the quinine family, anti-malaria. And you may know that quinine, although it's a very effective anti-malarial drug, which, by the way, also targets the red blood cells, that's why you get so anemic and tired with malaria, so it has some similarities. It's the quinine ultimately damages your liver. So I like to write poems a lot. I may read you my COVID one later. But I'm working on one which was, there's nothing scarier than a dose of cerebral malaria. It wasn't the gin that did him in, it was the tonic that made his liver chronic. Because it's the tonic that had the quinine, which was the anti-malarial.
Is there anyone who can translate the...
Mauve factor.
Yes.
It's not really, I'll explain that to you now. Basically, this goes back to the early days of exploring schizophrenia. And that was the discovery of something different in the urine of schizophrenics, which in those days was called the mauve factor, because when you put this agent into the urine goes mauve.
It's a color.
It's a color.
It's a color. It's about
Purple.
it's purple.
Violet, yeah. But I'll explain what it actually is. We're actually talking about something called pyrols in the urine. I will show you this. But this was a very early discovery of a man called Dr. Karl Pfeiffer, working again with Dr. Abram Hoffer. And he found a number of symptoms that were suggestive of having this mauve factor. Often, I'll explain these a little bit more, but we always look for this. For example, in our schizophrenic patients. No dream recall, poor appetite, white marks on the nails, stretch marks, very light sensitive, stress sensitive, these kind of symptoms. And I've written about this quite a lot in the book. I'm going to say more about this when we come on to a little bit on psychosis. But zinc, I think zinc is important. Here is a study that is giving school children, we're meant to have, maybe 10 milligram of zinc a day. I think it's too low, probably should be 20. But anyway, what it did was it gave children 20 milligrams of zinc, or 10 milligrams of zinc, or nothing. So one assumes they're eating 10 milligrams. Actually, the average is eating 7.5, so below the RDA. And what they found was only the higher dose had the fastest and most accurate memory and attention span. So the question really is that the recommended levels have not been based on any science for mental health. That's still an ongoing investigation. What is the level of zinc that correlates to the highest mental health? And the answer is probably above 20 milligrams. By the way, excuse me for saying this, but as you know, the richest source of zinc always is in seeds. Nothing grows without zinc. So like an egg, is the richest source. So as a consequence of that, you can work out that the richest source in the human body is sperm. It's packed with zinc. And as I said, the average person is getting 7.5 milligram of zinc. And I was reading in a fertility journal that they were measuring 3 milligram of zinc per ejaculation. So that means if a man has sex 3 times a day, he's blown it. And you may know in the history there is masturbation insanity. So if you masturbate a lot, it makes you insane, and it stunts your growth, which we know is zinc, and it makes you blind. And you need zinc to work with vitamin A for the eyes. So that's kind of where all that comes from. So oysters, Karl Pfeiffer had a girl called Lisa. It's brought to him. This is at the Brain Biocenter in Princeton, New Jersey, which he was my other teacher. And this girl was crazy. But they had solved her insanity. If she had an oyster a day, she was fine. No oyster, not fine. And that was how they found that oysters are the richest source of zinc. And actually, she had a zinc-dependent schizophrenia. With enough zinc, she's fine. So zinc and magnesium are the 2 most commonly deficient and most interesting minerals. Here is a study. I'm going to explain homocysteine more to you later on as a measure of methylation. They basically could predict a child's school grades just by knowing the blood homocysteine level. Just that. Healthy kids, smart kids, low homocysteine, just the homocysteine. I'm going to talk a lot more about that. Here is a study a couple of years ago. The critical role of B vitamins in the brain was studied, and supplemental B vitamins during the first 20 years of life, and compared it to cognitive function at age 25. Higher intake of niacin, B6, folate, B12 were all associated with improved cognition and memory. So we'll talk more about B vitamins. I was called in by another TV channel in the UK, and they had 3 boys who had been kicked out of school a number of times and were now kind of almost sort of prison, in a very high security sort of school situation. Liam was one, and he was sort of almost non-verbal, right? You say, "Hi, Liam," you might get a grunt. It was really that bad. Your homocysteine is meant to be below 7, and his was 24, which is the average of a 90-year-old. And after 4 weeks on an improved diet, this is what he said. And what was amazing for all of us was his ability to actually verbalize all of this. He was a child who never spoke, really. After 10 days, I noticed I was feeling less tired in the morning. Now I'm not tired at all when I wake up. I have loads more energy. I'm less bored. I'm concentrating better. I feel a lot happier. I'm getting on better at school and concentrating better in class. I'm also doing more activities and sports. I feel more positive about my future. Since starting Patrick's diet, I'm a lot calmer than I used to be. I haven't got into trouble at all. I'm going to stay on the diet for life and keep taking the vitamins. It's brilliant. And his homocysteine dropped to 9. Yeah. So you never know what it is. We've got blood sugar, we've got essential fats, we've got food intolerance, and we've got methylating B vitamins, which I will explain more in a minute. And this was a study that actually found that the excessive consumption of sweets at age 10 years predicts convictions for violence in adulthood at the age of 35. And just, quickly for our time, you kind of all know this. Studies, children eating breakfast complete the task at school twice as fast. Missing breakfast is associated with 30% shorter life listing span. And here, cognitive performance of 83 hyperactive children was significantly worse following a high GL breakfast to buttered white toast versus a low GL breakfast. This study I really liked from Yale University. Gave 25 healthy children a drink containing the equivalent amount of glucose found in a can of Fanta or Coke. And the rebound blood sugar drop boosted the adrenaline for over 5 times the normal level for up to 5 hours after ingesting the sugar. So very good for fighting, very bad for concentrating. For concentrating, you want to eat a stable blood sugar. You've got the study, so you can find the reference, and so on. Yeah, this is a double-blind study of dyslexic children found that a diet high in sugar caused more erratic eye movements than a sugar-free diet. So sugar in excess is implicated in aggressive behavior, in anxiety and hyperactivity, in attention deficit and depression, in fatigue and learning difficulties. It's an addictive anti-nutrient. So I had a few elections ago, a man knocks on the door and says, "Will you vote Conservative?" And I looked him in the eye and I said, "I never have, but I will on 2 conditions." And he said, "What are the conditions?" He says, 1, I want a sugar tax. Sugar is terrible. We need to tax it and make high sugar foods much more expensive, less desirable. And he said, "What's number 2?" I said, "Number 2, testing homocysteine in everyone over 50. And I said, "Why?" "For dementia and cardiovascular disease." And he said, "Well, it's funny you say that because I'm a GP. I'm a doctor. And I had a patient who had a heart attack, and I decided to test the homocysteine. This is very rare. And slightly sad because I actually got the results back like 2 weeks ago. Well, unfortunately, I got them back 2 days after he had another heart attack and died. And he was really high in homocysteine. So 2/3 of heart attacks in the elderly are not associated with cholesterol, but with high homocysteine. I'll talk more about that. Then we have study after study, randomized controlled trial, DHA and EPA, less hostility, DHA and EPA, less hostility, less felony violence in prisoners, less conduct and disruptive disorders in children, less physical and verbal outbursts, less aggression, et cetera, et cetera, et cetera. So we know that you need to get the DHA and EPA up. We all don't get enough. And eating fish once a week won't do it. Our ancestors were eating marine food every single day. We really need these. And if you're vegan, like in my new book out in a month or so, you can get DHA from algae. But if you're vegan, you cannot get enough omega-3 from flax and chia. It does not convert sufficiently to DHA. Here's an experiment of a guy called Willits in Aberdeen. And the experiment here is that this baby at the age of 10 months has got to find the toy that's hidden under this panel. And half of the mothers have been given omega-3 supplement during pregnancy, and the other half haven't. So they've got to remove the block, pull the cloth, grasp the cover, and find the toy. So here is a mother who was given the omega-3. Oops, it was about to start. Let me get out of that. Action replay. Moment of attachment. Yeah. Straight in there, huh? Here's a child of a mother who was not given the omegas. So this is at the age of 10 months. Already can't complete tasks. Ooh. Yeah, that's just that. So here is a study which looked at the DHA level in the umbilical cord of birth and the reaction time, if you like, speed of thinking at the age of 8. So the children with the highest DHA have the fastest reaction time at the age of 8. Here is the classic study of Alex Richardson and colleagues at Oxford, where children with ADHD are given supplements, omega-3 supplements, versus placebo, and for 3 months. And the reading age improves by 9 months in 3 months, and the spelling age improves by 6 months in 3 months. And on the placebo, the reading age improves by 3 months in 3 months, and the spelling age by about a month. And 7 out of 16 children on the essential fats were no longer classified as ADHD, compared to 1 out of 16 on placebo. So these were the changes in related symptoms. So yeah, blood sugar key, essential fats key, and I think that one of the big debates is if you give children more omega-3, does it make them brighter? And the answer is no. Not any child, but if you have a child who's got reading problems, writing problems, ADHD-type behavioral problems, then the chances are yes. And this is a recent study from China of school children find the fish consumption predicts sleep quality. More fish equals higher IQ, 4.8 points higher than those who ate none. Improved sleep quality linked to fish intake was correlated with verbal IQ, but not performance IQ. Verbal IQ is the underlying, is really, non-verbal is the one. But it's sort of interesting. So I think that omega-3s really calm you down. And getting enough sleep is really good. You know, if you get enough sleep, then you can concentrate. If you're really tired, you can't concentrate. You know, poor mood, motivation, hyperactivity, inattention, slower cognition, learning difficulties, excessive thirst, excessive urination, chronic fatigue, dry, rough skin, dry hair, dandruff, eczema, asthma, other inflammatory conditions. These are the kind of symptoms that will suggest more essential fats are required. Eating fish, eating seeds, chia is best, supplementing both omega-3 and omega-6. We still need omega-6. I know that there are a lot of surveys that show you that we have more omega-6 than omega-3, but a lot of the omega-6 in these surveys is from like sunflower oil and fried, you know, it's not functional omega-6, not functional omega-6. So for sure we are generally more deficient in omega-3. And then you have things like omega-3, 6, and 9, but really you don't need 9. It's not been proven essential. And unless you're totally fat-free, I mean, if you eat meat, you get saturated fat and omega-9. If you eat fish, you get omega-3 and omega-9. If you eat seeds, you get omega-6 and omega-9. So it's not, you know, there's a lot of omega-9. You're not going to be, it's just really marketing to say 3, 6, and 9, because you've only got 3 and 6. But 3 and 6 is what we need, mainly 3. Then there's this big issue about autism. This was a study, a very good study, which looked at an area of London and the prevalence of autistic spectrum disorder, very, very clear autistic spectrum disorder, 1 in 86 children. But the older estimates, if you go back, this was in 2006, if you go back before that, it said it was 1 in every 2,500. So did we previously miss 97%? Is it just that we're diagnosing it more? You know, we weren't seeing it before? Or is it really on the increase? Autistic spectrum disorder. How we work with children with autistic disorder is we always look at digestion. I'll talk a bit more about that. Often giving probiotics, digestive enzymes. We always look at magnesium and zinc and B vitamins and homocysteine, methylation. I'll talk about that. Essential fats. Vitamin A, very important. I will tell you about that. We check for food intolerances. We check homocysteine. So these are the kind of nutritional aspects. I don't think autism is purely, well, again, it varies from child to child, so it's not purely a nutritional thing necessarily. There are a lot of ways to end up autistic spectrum disorder. But these were some pictures I saw about what they called autistic behavior, but it's not autistic behavior. This is a child whose gut hurts, you know? And if the gut hurts and they have constipation or diarrhea or, you know, very windy, then this needs to be looked at. Look at the diet, look at digestive enzymes, glutamine powder, maybe probiotics, you know, so the gut can often be a major source of problems for autistic children. Also, if you can, Sunderland University did a very good job in measuring urinary excretion of gliadorphins and caseomorphins. So gluten and casein, wheaten milk, can produce these opioids. And if you're measuring them in the urine, you know that the gluten has got into the blood, and the body has produced this gluteomorphine, which is now excreted in the urine. So it kind of indicates a leaky gut, you know, type situation, which brings you back to the gut. So we find that a very useful test in relation to gut problems. And already I've spoken about this kind of sequence or way of thinking for sorting that out. Now, I will explain methylation in detail, but what occurs is that there's a part of the process of doing methylation that is low. Methionine synthase is one critical enzyme for methylation, dependent on B vitamins, is low in autistic children and can be suppressed by minute amounts of mercury and promoted by IGF, which is what you get in milk. Milk promotes insulin-like growth factor. And The main researcher on this is called J. James. If you put in J. James and autism, you'd get studies. Impaired transsulfuration in autistic children leading to oxidative stress reversed by supplementing the nutrients that improve methylation. They don't necessarily have high homocysteine, though. It's slightly different in autism. Here we have a study last year. The prevalence of autistic spectrum disorder was 14.1% in children whose mothers took prenatal vitamins in the first month of pregnancy, compared to 32.7% in children whose mothers did not take prenatal vitamins during that time. Children whose mothers reported taking prenatal vitamins during the first month of pregnancy were 50% less likely to have a child with a diagnosis of autistic spectrum disorders. I would say never get pregnant unless your homocysteine is below 7. And I'm going to explain all of this very, very soon in a minute. A lot of children and people with autistic spectrum disorder don't see things the way you and I see things. Their visual perception is disturbed. And what actually happens is in the center of the eye, you have more rods, which do the black and white, more cones, which do the color. And the rods that do black and white, there's more around the periphery. And these children or ASD people are not seeing a complete visual space like you or I are. And the rods are not working so well. And they can't, all the subtle shading of your face that determines your expression, you need good rod black and white vision, so they can't read expression. They love close-up color cartoon television. Everything is exaggerated, everything is color, everything is in the center region. If someone comes from the side, they can freak out because they don't see them in the same way we do. You can take them to school every day and they're okay. You take them the wrong way because there's roadworks and they freak out. Vitamin A. And for some reason, I don't fully know yet, the vegetarian vitamin A does not work. But the animal or fish-derived retinol does work. And it's required for cell growth and epithelial tissue and vision and repair in the gut and the brain and the immune function. I have a paper out already in the Nutrient Journal on vitamins and COVID, and there's a section on vitamin A. It's also very important. So some children that we've given usually fish-derived vitamin A, it could be cod liver oil, for example, very high in vitamin A, some vitamin D and omega-3. And this is one that says, now I know where my fingers are. Now I can see my arms at the same time I see my fingers. My box is getting bigger every day. Now I can see emotion on faces on TV. A 49-year-old. Right? So if you have a child who can't tie their shoelaces, for example, you could think maybe the vision isn't working. Let me try increasing vitamin A. Here is a study 2 years ago, a randomized, controlled, single-blind, 12-month study of a comprehensive nutritional and dietary intervention, 67 children and adults with autistic spectrum disorder aged 3 to 58, and 50 non-sibling neurotypical controls of similar age and gender. Treatment began with special vitamin mineral supplement, and additional treatments were added sequentially, including essential fats, Epsom salt baths. You can absorb magnesium actually through an Epsom salt bath, carnitine, digestive enzymes, and a healthy gluten-free, casein-free, soya-free diet. There was significant improvement in nonverbal intellectual ability in the treatment group compared to the placebo group. IQ increase of 6.7 IQ points, which is like what we got in our first study, versus a slight reduction in the placebo group. Statistically significant. So it's a nice study. So here is a study by the Sunderland group, and they looked at 824 children who had very clear, no question, autistic spectrum disorder. Very clear. And they asked the parent what they thought had caused the autism. And 55 said, without a doubt, the MMR vaccine. Without a doubt. And I've worked in this field long enough, and I have met so many parents. And by the way, I think this is a very, very small percentage of autism, who say, and it happens all the time. When I was building the place in Wales, my roofer, he said, I hear you know something about nutrition and mental health. I said, yeah, I do. He said, I have a child with autistic spectrum disorder. And I said, when did it start? And he said, when it was 2.5. And I said, what happened? And he said, well, he was developing perfectly normally, even ahead, and then had an MMR and has not spoken a single word since. Completely nonverbal. Immediate. And anyway, that's the number. And if this is correct, then 6.7% of ASD is attributed by parents to MMR, measles, mumps, rubella. So I was in the House of Commons the other day at some big debate, sitting next to a big TV doctor. And he said, so are you a vaccine denier? I said, no. I said, are you a vaccine damage denier? So there's no question that some are reacting to vaccines. And until one is even allowed to admit that, you cannot do research on what it is. Maybe it's the aluminium, maybe it's the mercury, maybe it's, who knows? But until we admit it, we can't really get the science done. And that's what's so annoying. 6.7% is equivalent to one child in 15. So that's the end of that section.